Welcome back. Experts say stealing and unused painkillers and prescriptions is an easy way for those struggling with abuse to get their hands on drugs. Unused opioids thrown in the trash or forgotten about can also be stolen and sold illegally. That's why the DEA and several local healthcare organizations are sponsoring drug take-back events today. To talk more about how this event works and the major impact these small leftover pills can have, Dr. Justin Deaton from Orange Park Hospital is joining us live. Good morning. Thank you so much for joining us.
Hi, good morning. Thanks for having me.
First off, let's just start about discussing the issue that is impacting the opioid epidemic.
Yes, it's still a significant issue, despite things that have been done both locally and nationally to try to cut down on the use of opiates. And one of the main ways that opiate addicts get the way these opiates make it to the streets are from unused pain medications that people may have been prescribed for minor procedures and they didn't take the entire amount that they were prescribed. And then in various ways, those pills find their way to the streets.
And how does the drug take back process work?
Well, so there's designated areas throughout the community, Orange Park Hospital being one of those, where you can bring any medication prescribed to you or someone else and turn into a licensed pharmacist or hospital employee. And we will ensure that those medications are properly disposed of and eliminate any chance of them ending up in the hands of someone that it could potentially harm.
And I feel like I've heard in the past that, parents leaving around drugs that they've used when they've had an injury or something, kids getting a hold of them, leading to addiction. I mean, is that common?
Well, the CDC reports that about 50,000 children every year are seen in emergency rooms for unintentional medication exposure. And most of the time, that's from medications that are sitting in the back of your cabinet that you may have even forgotten are there. And your child inadvertently gets into them and sometimes ingests them. So it's a real issue. And this is something that needs to be taken seriously. And I strongly encourage anyone that has any medications, not just pain medications that they're no longer using to find a local area where they can properly dispose of these medicines.
And what would you say to those who are holding on to those unused prescriptions just in case?
Well, so that presents a couple of issues. Every medication has an expiration date. It's usually about 12 months from the time it was prescribed. And not only those medications change their chemical properties, but more importantly, most of them lose their potency. So the medication you were prescribed a few years ago, let's say for some kind of upper respiratory infection, may not have the same potency. So you're not getting the effect that you're looking for. On top of that, anytime a medication is not taken to full for the full length of time it's prescribed can cause issues. And then oftentimes people change blood pressure medicines and diabetes medicines, and they don't dispose of the other medications. And there's been a fair number of cases where elderly people accidentally take the wrong medicine thinking it's something else. And it's all about not getting the effect that you think that you're getting and leading to some very dangerous and potentially deadly side effects.
Definitely important things to be aware of. And another thing too, I mean, if it just gets in the hands of the wrong person, if you leave them lying around, someone breaks into your home, things like that, it could just end up out on the street. And that's, opioids are one of the top killers in our country.
Absolutely. A lot of, even though we have outreach programs in the community to help with narcotic addiction, it's still a major problem, not only here in Florida, but across the country. We have pretty much daily patients that come in because of opiate overdoses that have to receive, resuscitative medications. And the more we can do to keep these medications out of the community, the better we'll all be for it.
All right, well, thank you so much, Dr. Deaton, for joining us this morning. There are dozens of locations available across our area where you can drop off your old prescriptions. The event runs from 10 a.m. until 2 p.m. And to find the closest location to you, head to DEATakeback.com.